Hello, welcome back to Healing Point Massage Therapy YouTube channel. My name is Leanna and you're here with us today. Desiree, our registered acupuncturist here at Healing Point Massage Therapy. Today, Desiree is going to share with us today the different modalities or techniques that she uses for her acupuncture treatments. So Desiree, we're gonna read this quote here.
Where there is no movement, there is pain. Where there is movement, there is no pain. Traditional Chinese saying.
I really love that. It's so true, right? And I have a fact here. According to College of Acupuncturists of Alberta, in 2019 annual report, there were 794 total number of registrants in Alberta.
That's awesome. We're slowly growing.
Yeah, that's awesome.
Fantastic.
Yeah.
So I'm really excited to be sharing about the modalities that we use. As a practitioner, I like to incorporate a lot of these modalities into the treatments. I get a lot of good feedback. Most people absolutely love these modalities, even if they haven't heard about them before. So I'm excited to introduce you to them today so that you're not going into this blind.
Awesome. So maybe we talk about how does acupuncture treatment start?
All right. So every acupuncture treatment, especially that first one, starts with an intake. So even if I have seen you before, I will still talk to you to start. I want to know how you felt after your last treatment. I want to know if you had any changes to your symptoms. I want to know how your week went. So it will usually start with that. Once I've caught up with you and understand what is going on and what I think would be the best form of therapy for you, I propose that to you. Then I usually give you a moment to disrobe to whatever level I have pre-discussed with you. And then I often start with needling and then finish up with modalities, but other practitioners have different preferences. Some may start with modalities and end with the needling. It is all up to practitioner and patient preference.
Yeah, okay, that's good to know. So how do you know if you need to add other modalities to your acupuncture treatment?
Yeah, that is a very good question. So myself as an acupuncturist, I have so many tools in my toolbox and I am so eager and excited to share them with people that I love incorporating modalities. So I learned each modality. I learned the indications, so when to use them. I learned the contraindications, so when this treatment or therapy might not be the best for you. And so I take that into account with you and your history. And then from there, we decide if this is going to be something that's beneficial or not beneficial. Usually I'll start with something small. I'll explain the therapy to the client. They will tell me if it's something that sounds good to them or if it's something they'd rather pass on. We usually start pretty light or pretty gentle. We do a little introduction and most of the time they love it.
Oh yes. I agree to that. So let's talk about all these modalities. So let's start with what is cupping and what type of cupping do you use?
So in general practice, so I have them here for you. So this is a glass cup. I also do use silicone cupping as well. I don't have it shown here. There is plastic cupping that is often an option as well. Some people do not find that as comfortable as the rim or base is more thin. And so sometimes it can feel a little bit more pinchy on the skin. So these glass cups I generally use for fire cupping. So what would happen in a fire cupping procedure is I take a cotton ball, I soak it in alcohol, we then light it. It will be at the end of forceps. Then what happens is the cup goes over the flame. The flame helps decrease oxygen and it creates kind of a vacuum. So then the cup is then set on the skin surface and it will cause the skin to create a vacuum seal. It's really nice because it promotes circulation in the body. It can also be used as a diagnostic tool, which is really cool. Depending on the color of the marks that are left, it gives me some idea of what's going on. If these are a very deep purple, that shows me that there's some stagnation there, and that's usually an area of pain and where things aren't moving, like we discussed with that quote earlier. When things aren't moving, that's when we get pain. So if I see it really purple, means things are a little bit stuck
in there.
Yeah, if they are red, it means we've got some heat in your system that needs to possibly be cleared out. And some people who have more deficient conditions, sometimes they will either be really pale or leave no mark at all.
So that's really interesting.
Yeah. And then silicone cupping, I find is easier for practitioners to use. It doesn't have the fire hazard of using fire cupping. I also find it really works well for sliding cupping, being able to move the cup along the skin surface, which is really good for promoting that local circulation and vasodilation.
That's awesome. And then what is gua sha?
Okay, so gua sha is actually two words. Gua means scraping, and sha is actually the characteristic marks that are left as a result of the gua sha. So this is a gua sha tool. They can be made up of different stones. This one is bien stone. Jade stone is becoming quite popular, or rose quartz for facial, because they're a more cooling stone. And what it allows you to do, it's a smooth, flat-edged object. You will scrape it along the skin surface, and again, it promotes the local circulation and vasodilation of those blood vessels, so that you are getting more oxygen and more nutrients to that area. And it helps break up stagnation. In China, they use this a lot prior to COVID for treating colds and flus, doing it on your chest or your upper back. Of course, in the era of COVID, usually if you do have symptoms like sneezing, coughing, sniffling, we request that you stay home. But that used to be a really good technique to help with colds and flus.
That's cool. And what is a tuina massage? Is that
Yeah.
did I say it right?
I don't even know if I pronounce it right most of the time, the tuina. It is a form of oriental massage. It focuses a lot on stimulating those meridian pathways. So following down or up the meridian, there are many different techniques that we use. Some of them seem more rudimentary, things like plucking or striking. Those are all very common to use.
Okay. And how about moxibustion? Sorry.
Moxibustion. Yes, that is a good question. So moxibustion can come in many different forms. I will show you a couple of them today. So this is stick moxa. It kind of looks like a little cigarette here. If you look inside, there is a herb. It is mugwort that we use for moxibustion. And so what it does, we light the one end and we will hover it over the area that we want to stimulate. And it's really good because it allows us to stimulate the acupuncture point without using a needle. We stimulate it thermally by introducing heat to the system. So this is one that I will just hold over. Usually I will ask a client to tell me when they feel it's warm. And then when they say it's hot, I will remove it. I will often push a finger down, and then we will often repeat that. Moxibustion has gained a lot of popularity over the years, because there's a point that we can use moxibustion that will actually turn a breech baby, which is really, really cool. This is another form of moxibustion. You can actually stick it on the needle and then light it, which is really cool. Or some clinics are not able to allow moxa because moxa will emit a smoke and an odor, which some clinics and some businesses may not allow. This is another alternative. This is smokeless moxa. So it does not have the mugwort, but it is still something that will burn and will emit that radiation that can stimulate the acupuncture points.
Cool. And okay, what is an electroacupuncture?
All right, so electroacupuncture is this bad boy that kind of looks like a little Game Boy over here. So when you have acupuncture, this is similar to a TENS machine or Dr. Hose, which provides a low level of electrical stimulation, but instead of having that stimulation through a transcutaneous pad like the TENS or Dr. Hose, the way that it is connected is by using what looks like little jumper cables for a car battery. So these would attach to the needles, then your practitioner would turn on the machine. They would ask you when you first feel it, and then to let them know when you feel a strong intensity, but it's not uncomfortable, it's not painful, and we'll leave it there. It's a way to constantly stimulate those acupuncture needles during the duration of your treatment without the practitioner staying in the room and manipulating them manually.
Okay, that's really cool. So does the client have anything wrong with them to get an acupuncture treatment?
No, in fact, some of my favorite treatments are those people who just want to achieve optimal wellness. So you don't need to have a disease, you don't need to have an illness, you don't need to have an injury. We can identify some imbalances before they become problems. And even if there is no underlying imbalance, we can always just optimize some of those systems for you.
Yeah, so how can I get started on an acupuncture treatment?
Yeah, so I would recommend looking for a practitioner that's right for you in your area. Myself, I'm located in St. Albert at Healing Point Massage Therapy Clinic, and that is always an option. I recommend doing your research, looking into an acupuncturist that suits your needs, that has a schedule that works for you, that has the qualifications. Make sure that if you are in Alberta that they are regulated and certified with the CAA. That is very important. And then a lot of clinics, including ours, have the ability to either call to book in, you can email us for any inquiries, or you can book yourself online as well.
Yeah, that's great. So yeah, so that's all the time we have left for today. I want to say thank you for tuning in with us today with the Healing Point Massage Therapy YouTube channel. If you enjoyed this video, hit like, and if you'd like to know more about acupuncture, please hit subscribe. Thank you so much, and we'll see you next time.
Bye.